BronxNet. Your voice, your views, your vision.
The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
I am Errol Schneer, Bronx-Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in this program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx-Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx-Lebanon's Vice President and Medical Director, and I will be discussing the problem of chemical dependency and how it is being addressed.
Joining us this evening to discuss this most important topic is Dr. Camilla Green, Administrative Director, Addiction Treatment at Bronx-Lebanon Hospital Center. Dr. Green is an expert in the chemical dependency field with extensive experience in administering and implementing innovative programs that are clearly making a difference for our Bronx community.
Now, before we hear from you, Dr. Green, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Now, let me start the program, Dr. Green, by asking you to give our viewers a definition of chemical dependency. What is it?
Chemical dependency is a maladaptive pattern of use of substances. This could be illegal substances or legal substances like alcohol, where individuals have difficulty fulfilling their normal life functions, like participating in relationships, going to work. Oftentimes, individuals find themselves in legal difficulties, as well as they oftentimes find that their use pattern increases. So when they might have had one or two drinks at a sitting, they may begin to increase their use patterns to get the same effect that they used in the past, as well as they also may become physiologically dependent on the substance, where they can't stop using it without feeling really sick or needing to go into the hospital.
Okay, can you identify the specific chemical dependency problems in our Bronx community? Tell us some examples.
We see the wide gamut of chemical dependency problems, where we see alcohol as an addictive problem, as well as the illegal substances such as marijuana, cocaine, heroin. We've seen a significant increase in the abuse and the selling, the illegal selling and distribution of prescription medications, as well as what we call designer drugs, which are now coming into the community, things like bath salts, that a lot of the younger kids are using, which actually lead to a significant amount of medical complications.
Okay.
And how do you treat these problems? What is your process? Maybe you can elaborate a little on.
Well, we'll talk a little bit about the Life Recovery Center, but in terms of just a general treatment, you would need to help the individual, particularly if someone has an initial medical dependence on the substance, to detox from the substance. So they may go into an inpatient detox facility. And then you have to teach the individual new coping patterns for living in their day-to-day life.
Well, what's proven to be effective?
Well, typically individuals will have to be removed from their community or removed from their environment so they can learn to establish 30 days of sobriety and begin to learn new coping patterns.
By sobriety, you mean what?
Where they don't use the substances for at least 30 days. So that may involve things like going to groups, that may involve using new innovative medications, that may involve learning new coping skills, because individuals often use substances to cope with difficult emotions. And so that's what we teach them in our groups.
Do you really think that that's part of the problem? Coping, just coping, daily coping?
I do. I mean, I think we can label it many different things, but individuals have different abilities in terms of emotions that they can tolerate or life stressors that they can tolerate. And over time, people develop both a psychological and a physiological dependence on substances to help them through feelings like anxiety, depression, stress, tension, trauma.
Okay. So can you describe some of the innovative and evidence-based practices that are utilized in your treatment program? Make my question simpler.
Okay. Well, one of the most effective treatments that we're using right now is what we call motivational interviewing. And what that means is that you work with a client where they're at. So someone may come in and say that they want to stop drinking, and you help them understand the difficult problems that drinking has resulted in their lives, and then help them to move towards a new way of living. So you help unearth each client's motivation for change, rather than relying on punitive or helping or discussing all the negative aspects of their use.
Yeah.
Now, how does substance abuse impact the general health care of a community? And perhaps you can give us some specific examples.
Well, that is a very good question, and I think we see this across the hospital. A significant majority of all the patients that come into Bronx-Lebanon, not just the addictive population, use substances. So we see a higher incidence of cardiac problems. We see incidences of asthma due to children's exposure to their parents smoking of different substances. We see people that have digestive disorders due to use of opiate medication. So there's a significant comorbidity with addiction and health. And even on the baseline, people who are using substances don't eat healthy diets, they don't drink enough fluids. So there's many instances where people just aren't taking care of themselves because of the chemical dependency problem.
Okay, we have a question for you. Diana, you have a question for this good doctor.
Yes, I do. I was wondering if chemical dependency was hereditary.
Is it hereditary?
The research certainly has demonstrated that individuals that have addiction in their families have a higher likelihood of also having using substances themselves. We're not quite sure whether that's sort of a nature or nurture issue at this point in time, but oftentimes there's modeling in the family for using substances, in different social situations, as well as we know that chemicals affect everyone's brains in different ways. And so if you have if you inherit that genetic predisposition to use substances in a particular way, it is more likely that you will be at risk for developing a chemical dependency.
Thank you, Diana. Thanks for the question.
Thank you.
Do you and your staff use alternative modalities such as massage, acupuncture, and exercise training in your treatment regimes?
We are looking to do that. Thank you so much, Dr. Gums, for asking that. Acupuncture is very well studied, and it's been proven to be very effective in reducing pain, in particular in patients that have previous opiate addiction. So we are looking to implement that in the New Life Recovery Center, as well as we have looked at some of the research from some of the innovative centers on the West Coast where they use a lot of massage, which indicates that, again, individuals that are learning to cope with painful feelings and painful physiological sensations, that massage can also be helpful as they're detoxing from some of the opiate medications.
Okay.
Now, how can family members of a individual that has a chemical dependency problem help out? What can they do? Do they work with you? Do you bring them in as well?
Absolutely. One of the innovative aspects of OASIS treatment is that a family member can enter our treatment programs as a client themselves. And we have groups slated directly for family members.
Let me interrupt you. What is OASIS treatment?
Oh, thank you. I'm sorry. OASIS is the Office of Alcoholism and Substance Abuse Services in New York State. So that's our regulating body in New York. So we get our direction from Albany. And we are, as a result of that, we are allowed to intake family members that can come into treatment. And we have specialized groups where family members can get support and learn how to interact with their substance abusing family members or friends. And so we encourage them to set limits with their substance abusing family members, as well as to encourage them to utilize other ways of coping with difficult situations.
Right. And on that note, let me pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at bronx-lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery in the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at bronx-lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of bronx-lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And bronx-lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. Moving to a different subject, Dr. Green, a question we often ask our panelists is to share their respective backgrounds with our viewers and what interested them in their respective field. And I turn that same question over to you now.
So I was interested in becoming a clinical psychologist because I found that psychopathology and helping to understand the human condition was just so interesting to me. And I wanted to find a way in which I could contribute back to society. And so I found that my way to chemical dependency through my work at the Veterans Administration's Hospital when I worked in Boston. And I found that so many of the veterans were afflicted with chemical dependency that it was really a way in which I could do the most good and really help a broad spectrum of society.
Now, in terms of the actual schooling that you had to undertake to get your degree, perhaps you can share that as well.
Well, I got my doctorate degree at Boston University, where I trained at both the Veterans Hospital as well as Boston Medical Center, and particularly training in the treatment of anxiety disorders as well as the treatment of trauma.
Right.
Okay. Do you consider chemical dependency to be similar to a medical problem? Is it a disease or what? How do you categorize it?
Well, that's a very
loaded, right?
That's a very loaded question, but again, a very good one in that chemical dependency can be considered a disease particularly when we look at, again, the new research that's coming out, and that it's a chronic condition, and that it's a chronic maladaptive behavioral problem that is akin to diabetes or asthma that requires long-term maintenance. Whether it's a disease in the sense of having a particular etiology like heart disease, I think is still up for debate, but I think that it should be treated in the way of some of those other disorders that I mentioned, and that it requires continual influence or collaboration from treatment providers, as well as that medications can be effective and that we know that there are certain particular treatments that are effective.
Do you ever walk away from this problem and say, well, I have beaten it and now I'm cured?
I think that's a dangerous slope to get on. I think that you can certainly be in recovery, and that's what people within our community call it, that you're in recovery, and that can be a very positive place to be. However, it's something that will require at least some attention throughout your life. And again, I think that's why thinking about it like someone that has diabetes. You can eat things that you want, you can moderation, but you can't forget that this is something that's a risk factor for you.
Right. Now, another question we ask our panelists is to share their respective success stories with our viewers. And I'm sure in your area there's some very dramatic successes that you have. Can you share some of them with us right now?
Certainly, we have many success stories. I think one of the most effective treatments that we have right now is our community residents, where we have clients that come and live with us for around 6 months, as well as attending our intensive outpatient treatment programs. So we have someone who just recently started working again. They obtained their CDL, which is a commercial driver's license, and now is a fully employed working member of society, off public assistance, reunited with their family, and contributing to society.
So there is hope out there.
Absolutely.
Right.
Do you and your staff provide treatment for mental health problems? And how are chemical dependency and mental health problems related? Or I guess they're all...
We do provide treatment. I think that there is the phrase again within our field called co-occurring disorders, which means that someone has a substance abuse problem as well as a psychiatric problem. That would be, say, dependence on alcohol and maybe depression. And we do provide treatment, both chemical, meaning psychopharm or prescription medications, as well as behavioral treatments for depression. And what we see is that, again, there's the intersection between those two, where someone who might have depression or bipolar uses the substances to medicate their manic episodes or their depressive feelings. And so we see that you really cannot treat one without the other.
So your task many times is to separate them and treat them simultaneously.
Treating simultaneously, and that is the key. As we know now, very few clients actually get that effective simultaneous treatment that they deserve, and that's one of going to be one of our main focus at the New Life Recovery Center.
All right, now you mentioned this Life Recovery Center. Just what is it, and what types of patients will it be treating?
Well, you've noticed that I've slipped that in there a couple of times, but we're very excited about the Life Recovery Center. We're going to be opening
how many beds, etc.,
at the end of this summer, and we're going to feature within the state of New York, the only facility that has all 5 levels of addiction treatments, and that is starting with inpatient detox, where we're going to have 20 beds. Inpatient rehab, which is our program where clients come and stay for 21 days. We'll have 25 beds. We will then have an outpatient addiction program, our intensive outpatient as well as outpatient, as well as our driving while intoxicated program. People that have had that conviction can come and get that alleviated. We work with the legal system very closely. And then we also will have a primary care clinic affiliated with the treatment center, where all of our clients will have coordinated primary care with their addiction treatments.
Good. Expanding a little on Mr. Schneer's question, when will this famous building that you're talking about, Life Recovery, be completed? And what types of job opportunities are there? Do you have a job for me, maybe?
We would love to have you, Dr. Gums. I'm gonna remember this. So the building is slated to be, construction is slated to be finished in June of this year, 2013. And we anticipate entering the building towards the late summer. And there will be many job opportunities. We're looking for counselors. We're looking for, as we mentioned, licensed practical nurses to be working in our primary care clinic, as well as primary care physicians. And one thing I also didn't mention is that this will also serve as a training ground for social work interns,
Right.
psychiatric residents, as well as primary care residents.
Right.
It's good.
Now, on a totally different subject, the medications that you utilize in your treatment approach, can you explain what they are and if there are any side effects that might be associated with their use? And how effective they are as well, obviously.
Well, the medication that's most often associated with chemical dependency is methadone,
Right.
which is for opiate addiction. So we do still use methadone as a primary line of treatment for opiate addiction, and we have a separate methadone program. They will not be joining us on the Life Recovery Center, but they have a wonderful facility at present.
Right.
And a new other medications is Suboxone, which is utilized is in parallel with methadone, but it allows the user to not have to attend program on a daily basis. It can be prescribed by an outpatient physician and individuals who are working or who maybe only need a 30-day prescription. We prescribe that for them.
Right.
As well as there's some new work with some medications we call that help deal with the urges and cravings for substances. One is called a Camprosate. Camprol is the prescription name, as well as naltrexone. And those medications are used to help ebb the cravings for the substances, and we do see some effectiveness in those.
Right. Now, recently there's been extensive publicity surrounding an actress that refuses to go into a treatment center because they won't let her use Adderall. Why is this becoming such a problem, Adderall in general, and maybe you can explain why it's not a solution to every problem?
Well, Adderall is difficult because it often is prescribed in cases of ADHD. However, Adderall is a powerful stimulant medication. It's similar, as Dr. Gums can tell you, to an amphetamine, which we also know is a substance of abuse. And so when you're in an inpatient facility, when someone has a controlled substance, which Adderall is, it can be abused. And typically we want to help individuals not rely on substances to cope with other issues that they may have. And oftentimes there is also the concern of diversion, that individual themselves may not be taking the medication, but they may sell or give that medication to other clients in the
Now, are young
facility.
people increasingly using this to study or even
Absolutely, absolutely. It's a significant concern. For someone who has ADHD, Adderall can help focus them. For someone who does not have ADHD, which is attention deficit disorder, it can serve the same functions as amphetamine bought on the street. And it certainly can help them study, but it can also become a medication of addiction and can lead to serious, serious medical consequences.
Right.
This is not a political question, but I want an answer just to say. How will the new healthcare reform affect the chemical dependency treatment programs?
We feel that it will help us in the sense that it puts chemical dependency as well as mental health diagnoses on par with medical disorders. So there will be more funding for the treatments that we provide.
Right. Now, how do individuals in the community gain access to your services?
Well,
can they walk in or?
Absolutely. One of the innovative things that we will be implementing at the Life Recovery Center is a centralized intake where an individual will come in, they will get a medical screening, they will get a psychological behavioral screening from one of our highly trained staff, and we will make a determination of what level of care that they need. But they'll have access to all 5 levels of care as well as medical care.
Right. Now, can you also differentiate for our viewers the differences between the outpatient aspect and the inpatient aspect?
The inpatient is where an individual will come and stay for either 2 or 3 days, as I mentioned, for the medical detox, or 21 days for the inpatient rehab. And that is where an individual really needs a secure, closed environment to be away from the substance cues and triggers that have provided them such difficulties. On the outpatient level, the individual has a stable home environment where they can go home in the evenings, and they need support and guidance and treatment only during the daytime hours.
Right. Now, another subject we haven't discussed is alcohol addictions, or even cigarette addictions for that matter. How do you address those?
Well, alcohol is a substance, as well as nicotine within cigarettes, as with any of the other substances. And so if someone has an addiction to those, we really don't differentiate between the substances. We differentiate between the problems and the behavioral difficulties that a person has encountered as a result of their use. And so our clients that have alcohol, cocaine, heroin addictions are treated simultaneously and together.
Right.
Well, I don't know. Let me ask you a question it's important to me. I remember when I was a resident many moons ago, we had substance abuse, but Narcan was the medication that took care of most of the problems. They either died quickly or woke up, and then we never saw these patients again. But now we have patients coming to the operating room who stop on the way and have had cocaine. How do you explain the quantity of problems nowadays?
Well, I think that's just the availability of the substances.
But should all have always been there?
Well, it's flooding the community. So I think that, and I think that it's also individuals find that due to joblessness, due to other social maladies that they're suffering, that they turn to substances to cope. And what the example that you gave often, that you mentioned with the Narcan, is that was to prevent overdose.
Right.
And so,
but that was the treatment, because
that was the
treatment. Took care of most problems.
But what we learned, and as we can see that these problems are still around, is that that's just the tip of the iceberg.
Yes.
That individuals really need support and guidance after maybe they've sort of been prevented from having their, from their breathing stopping or their
In the time remaining, what is your advice to our viewers, the do's and don'ts of chemical dependency?
I would say that if anyone needs treatment, if anyone needs a consultation, to seek treatment in its many forms. Certainly, we celebrate the Life Recovery Center here at Bronx-Lebanon, but there are many community forums, AA, Alcohol Anonymous, or Narcotics Anonymous, where individuals can receive support within a warm, welcoming community to help individuals change their life and move towards recovery.
And on that note, Dr. Green, let me thank you for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for joining us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week when we'll be discussing the comprehensive outpatient services offered at the Bronx Care Tiffany Medical Center and the dental practice. Thank you.
In looking to the children, our future, we take